Welcome to Coffee with Dr. Stewart. This show will provide our listeners up-to-date medical information from a leading neurologist and neuroimmune specialist. Your host is Courtney Stewart, and your medical expert is Dr. Kendall Stewart. So grab your favorite beverage or cup of coffee, and let's have Coffee with Dr. Stewart.
Hello, everybody, and welcome back to another episode of Coffee with Dr. Stewart. I'm your host, Courtney Stewart, and today we're going to be bringing y'all an episode on dementia. I know it's a very big topic right now, and so we're excited to dive into it. But before we do, I got to ask, Dr. Stewart, Dad, how are you doing today?
I'm doing good. Yeah, I'm doing great. My life is very blessed.
Awesome.
Yeah.
Are you ready to dive into today's topic?
I love this topic. We talk about it all the time.
Yeah.
So, no, it's a huge topic.
Yes, let's do it. Well, we chose dementia and then a little bit kind of with Alzheimer's too, because it's so big and prevalent in America. So many people, I think, especially young people, like we're scared, what if I'm going to get it? How do I know if I'm going to get it? And then also seeing their grandparents or parents walk through it too. It's very scary.
Absolutely.
It's very sad. And so I know that there's a new genetic panel coming out.
It's already out.
Oh, it's out.
Yep.
And so for dementia, and so we want to dive into it. But before we do, I want to see if you can define what is dementia. I literally just had a friend ask me yesterday, what's the difference between dementia and Alzheimer's?
Yeah.
And how do you define it?
So dementia is basically easily defined as a loss of cognitive function, which means you're just not yourself anymore. You can't think straight. You can't remember things. You repeat yourself. And everybody knows it when they see it.
Yeah.
And, you know, a lot of times when you watch your grandparents or your great-grandparents age, you know it's coming and you're like, oh, my gosh, you know, how bad is this going to get? And so the second thing, though, that happens in most dementias, it's not only loss of cognition, but it's also a loss of mood and loss of calculations and loss of everyday life skills. And so basically it's defined as a loss of cognitive function where it affects your everyday life. Okay? Now, the problem is dementia itself is kind of the syndrome category.
Okay.
Which means it's kind of like saying, I have a car. Okay? And then there's different types of dementia, which Alzheimer's is the most prevalent. And so therefore it's the one that everybody talks about. But those different forms of dementia basically are more like deciding, oh, I drive a certain car. So I drive a Toyota or I drive a Toyota Sequoia. I have a specific type of dementia. And so everybody gets that. They kind of use it interchangeably, so you have to talk about it. But there's basically about 4 or 5 different recognized forms of dementia, depending on the pathology that we see in the brain. And the problem is you can't really tell a lot about that until the person's already gone.
Okay.
And so
so you don't know how it starts or
nope. And in fact, you try. Well, we do know how it begins. What I'm going to tell you, it's actually much more complex than people think. And that's what the new genetic panel shows us. Now, we have recognized in Alzheimer's in particular that we do have some buildup of certain proteins that not only build up in the brain but also build up in the blood. So there is a new blood test that got approved by the FDA last year where we can actually see the levels of these proteins and see if they're starting to create a problem for us. And so that one is for Alzheimer's specifically, but this panel that we're going to be talking about from a company called Extending Me. It's a new company that I am working with because I'm actually involved in how do we reverse some of these things we find, both nutritionally, dietary, functionally. And so we want to understand if there's risk factors that are a little bit more prevalent, but because before we really only had 2 genes that really talked to us about Alzheimer's, and it's 2 genes about one thing, and it's called an ApoE. Okay? ApoE, apoprotein, or apolipoprotein E has different forms, and there are certain forms that are associated with preventing the risk of Alzheimer's, some that give you normal risk, and then some that actually give you increased risk. And it requires 2 genes to actually measure that type. But what I'll tell you is that dementia is a really big problem. In fact, the latest research shows about 55 million people in America are affected by dementia of some type.
Wow.
Okay. And I want to say it's like almost 200, 300 million worldwide. So it's something that doesn't escape any culture.
Yeah.
It doesn't escape any racial group, any cultural group, and is going to be a bigger problem as the population ages.
Yeah. So is it more prevalent in our age now? Like, would they see dementia and Alzheimer's like 100 years ago or so? Like, was that common?
I think, well, so 100 years ago, people died a lot earlier. So we are certainly during the 80s, 90s and something, we have had a huge increase in the life expectancy of people because we're just getting better at overall medicine. Yeah. And I think health awareness, there's become a really big push for understanding it now from a prevention standpoint, because if you ever have a loved one go through it, I mean, it is one of your biggest fears. Yeah. And the older I get, we have it run in our family. My Uncle Sid got it horribly. He was a physician and then basically just lost everything. And he just was super smart to me and then was just, he was just a fraction of himself. And so it becomes very, very concerning to everybody who's seen it, especially in their family. And then the problem is once you get to be in your 50s, if you start getting into brain fog or you start forgetting things, you worry immediately about it. Yeah. And so I think the nice thing about the panel we're going to talk about is it gives us a good understanding of your relative risk, not necessarily it's in your family's good luck. What happens now, unfortunately, a lot of people aren't interested in prevention for that, or they don't have a reason to be interested yet. Yeah. And so we're learning that instead of just one gene that really gives us a risk of Alzheimer's, there's actually 51 genes in this new panel, and we'll be adding more. And so I think that it's just something that I'll never talk to an older patient. Now, older patient means 55 plus. Okay. That's not concerned about making sure they don't become a burden to their family.
Yeah. Yeah.
Okay.
All right. So before we dive into the genetic portion, a lot of people don't even know what the different types of dementia are, what the different stages are. And so could you kind of dive more into that?
Yeah. So we actually define dementia according to what we find in the brain after these people die. So what's really important to understand about dementia and its development, but also what goes on at the cellular level, is that stress on the physiologic stress, which means stress on the cells of the nervous system, provide a problem. Yeah. And that can be stress from inflammation, which we find out is probably neuro-inflammation is just a huge new topic, and it's probably the most significant stress to us. Almost all forms of dementia involves something to do with inflammation. Okay. The second is metabolic changes, which means that we metabolically challenge the cell to where it's even more stress. And if we have a deficiency in something and we stress the cell and it works harder, we've got a bigger deficiency. Yeah. So it tends to multiply its effects. And then we also have some problems inherent in the cell where the cell has a genetic weakness where it can't remove things. So in general, all the types of dementia are kind of defined by the type of protein that collects in the cell. Oh, okay. So really what's going on in most of these cells is that we see an accumulation of a certain protein that just gets so overwhelming it clogs the cell where it just can't do its job. Yeah. I kind of explain it like a hoarder's house. If you have a hoarder's house, how easy is it to walk through it? Yeah. So remember these cells, it's even amazing they work. Because being able to produce a neurotransmitter, for instance, know when to send it out, know when to how to take it back up, know when to transport it to different regions and to do what it's supposed to do is even amazing that it works. Yeah. Okay. And the smarter you get, the more it's very clear that a creator was there doing it. Okay. Yes. Now, when we try to define the different types of dementia, we basically come across different proteins that are deposited in too high a quantity in specific cells in the brain. And so a lot of times we can't ever tell that those are actually built up until the person dies and we know what type it was. Now, we have associated some symptoms that tend to affect some parts of the brain more than other ones. Yeah. So Alzheimer's tends to affect the whole brain, and it really has to do with two proteins that are involved. One is called p-tau, and the other is called amyloid, okay? And so amyloid and p-tau have this funny relationship is that amyloid essentially keeps the neurons very healthy in their links, and the p-tau tends to the tau protein wants to kind of glue them together. But we've known that some people actually want to phosphorylate that tau. And when you phosphorylate that tau, it basically, instead of being able to glue the skeletal structure of the neuron together, it won't stick. And so what will happen is the cell will essentially become very architecturally not smooth and just not function very well. And so we'll also see tangles develop in the amyloid. And so it is basically a very specific type for those two proteins. The second one really has to do with Lewy body. Lewy body is a very specific group of proteins that basically have to do with DNA metabolism. And basically they'll tend to clump together in little bodies. And so when you look at it under a microscope, we'll have these little bodies that are kind of filling the different areas. So instead of having dementia throughout all the functions, or we really affect more of the emotional center and the frontal organization. And that actually has to do a lot with alpha-synuclein, which is another protein that loves to build up in the cells in general. Now, what's really unique about all these three types is that it's not the protein buildup. It's the protein buildup that's the problem, but it's not the fact that the buildup just happens in some people and doesn't happen in other people.
Yeah.
If that cell is under stress and is trying to make these proteins will actually misfold.
Oh, okay.
Which means that the way we make proteins in the body is we fold them in very specific architectural designs, and so they fit and do everything just the way they're supposed to. But if you misfold those proteins, they can't do their job, and so they start to accumulate and just start clogging the whole system up.
Wow.
Okay? The last form is called vascular dementia, and that is where you really interrupt the blood flow to that area of the brain. So it has a lot to do with stroke potential, but also just not getting enough nutritional supply to those cells where they start to deplete. So those are the four that we essentially define clinically. Okay. But the unique part of all of them is that those cells, the reason they start to do this, and we're really not sure exactly why some people do it, one type versus the other type, probably has to do with the genetics that we're looking at now. But in general, what will happen is we'll start to notice that cell, which is really stressed and not able to quite keep up, because we use our brains every day. We use it when we're awake. We use it when we're asleep. If we can't keep enough energy in that cell, if we can't keep everything running right and the cell gets too stressed, it just tends to overload the cell and it starts to do things it's not supposed to.
Yeah.
Okay.
Yeah.
And so overall, those are the types that are defined. Now, they have a little bit different symptoms, but really the symptoms are not different enough where you can actually tell exactly which form you're dealing with. And I think that's why you need a genetic test.
Yeah.
So the genetic test tells us basically about different areas that can get into stressing the cell. And it's really aimed at not somebody who already has severe dementia. If you've already got severe dementia, probably not a whole lot we can do because all those cells are already clogged up and the body is it's going to be very hard to reverse that in our current understanding. Ultimately, what we do if you get dementia, we always want to give drugs and we try to squeeze the cell harder, and then all of a sudden it's working harder and we really almost potentiate the problem in some way. So as a general rule, medications for dementia patients have been a pretty big failure. They're really not as effective as we'd like. And even it's just more effective if we can catch it in more of a prevention mode.
Yeah.
And we can start to do things that keep that from happening. And it's all about making the neuron comfortable in its skin so it doesn't overwork itself.
Okay. So dementia is more of an inflammation problem, or is it more of just a overwork? So
inflammation creates override and overwork. Remember that when you essentially inflame a neuron, you're essentially putting it under stress. And the problem with the nerve cell is that it just can't rest. It will never rest. So all it knows how to do is work harder. And so the harder it tends to work, the more mistakes it tends to start making. And then all of a sudden, you've clogged the system up. And eventually you wind up in dementia. Now, it looks like that most of this stuff starts very early and actually can progress along maybe a 20 or 30-year time frame.
Yeah.
So what we're hoping to do is to recognize it early in people who have the biggest concern, and then basically start to prevent it then, so we can keep the cells a lot more comfortable.
Yeah.
So it's really interesting that the way this was accomplished is really the way we're actually approaching this whole concept of understanding disease states and understanding how people get there. We've really started to put a lot more emphasis on prevention than we have on waiting for the problem to happen and do something with it. So what this company Extending Me does is we've now become so sophisticated that the worldwide database is kept in one place. So if you're a scientist and you find a gene that may be correlated with a specific disease process, they write literature. And we have companies now that are called bioinformatic companies. So their whole job, and the ones Extending Me uses, is we use one in the UK and one in India. And every day when the literature comes out, they essentially create a database of all that new information, that new gene, and put it into their database. So at Extending Me, what we've decided to do is we decided to essentially take what's called the global array of single nucleotide polymorphisms. There's actually 700,000 genes on the array.
Wow.
Okay, 500,000 of them are human. 200,000 of them are agricultural. Okay, so we also do this for crops. Okay, but the 500,000 that we essentially put in the database, what happens is we just know that these are genes that could be correlated. We don't really know which ones are important, which ones are not. So what we did is we asked these bioinformatics companies to scan their databases, put in a specific disease process like dementia, and find everything that was correlated in the literature to what could be potentially give us a risk of developing dementia. Okay. Now, once we have that data, and the reason we decided to do so many genes at once is we never have to retest you. It's already what it is. So if we come up with a new panel, a lot of the expense is running the test. So if we come up with a new panel or we have additions to this, it's just we just go in and grab it out of the database and we can keep the prices really low. So like the dementia assessment panel in my office, which is this panel right here, if you want to see it, it's by a company called Extending Me. This has 51 genes in it, not 2. Okay. And those 2 only apply to Alzheimer's. This applies to all types of dementia. Okay. And those 51 genes fall into about 6 different categories that we're able to correlate to dementia. And the way we approach each of those categories is very different, meaning that nutritionally we can approach it, exercise, activity, brain activity, all those types of things gives us a very more narrow picture of where your weakness really is, so we can go and approach it from a much more preventative stance. Okay? So this panel was really made specifically for people that have a family history of dementia and you're worried about it, people who start getting into early signs, maybe in their 40s or 50s and start getting brain fog.
And what are some early signs?
Yeah, so the early signs are basically, most people think it's, I forget something. That's not necessarily true. I went into the room and I knew what I was going for and I forgot it. I'm going to tell you that happens at most ages, okay? So don't freak out about that. But when you really start dropping people's names, you don't remember somebody's names and you were good at names, when you really start questioning your brain fog, your clarity, everybody starts to worry about it, and they're worried. When they come to the doctor, that's what they're worried about. And so we wanted to have a tool that essentially was able to assess that person and give them a real answer. So I can't take all the credit. We had a group of about 600 neurologists approach the company. This was about 1.5 years ago. And what they actually asked was, they were screening for dementias for people, but they really didn't have anything to offer. Okay? So what they asked is, could we create something that we could actually get an early indication? Because the earlier we get to something, the better. If it's going to take 20 or 30 years for you to get into that dementia, if we can start 20 years before, the chance of us getting there is not near as great. And so we essentially asked these bioinformatic companies to pull together this data. We had a bunch of PhDs working on it. They did a great job at accumulating and filtering through these things to come up with different indications and give us a very kind of thorough look at specific areas with very validated scientific genes so that we would be sure that we got the right assessment. Now, there's not one gene that causes dementia. Okay. And so what this also did is we have one section which is kind of the overall risk of what we know for dementia. It has 17 genes in it.
Okay.
Some of them are more powerful than other ones. So what these PhDs did, which I think was extremely clever, is they basically came up with a risk level of each of those and how important that was. So there are some genes that carry a lot more weight than other genes, and they came up with an algorithm to essentially, for that section, give us a relative risk. Is it a low risk? Is it a medium risk? Or is it a high risk? The ones that will have to do something are obviously the high risk people. The medium risk people, you probably want to instigate some of those changes to your diet, to your exercise activity, to your cognitive training. Okay. So, and when I mean cognitive training, we'll do things like learning a new instrument or learning a new language.
Yeah.
It's not just playing computer games.
Yeah.
We found out computer games are great, but they really train you on how to do the computer game good and don't really give you overall function. But something that's much more broad, like a new activity, writing a book or doing something like that, it really turns out that makes the brain very plastic, and it actually utilizes its energy right and starts to essentially rest and calm itself down and do lots of new things that really surprised us a little bit in how that would work. But we actually find out the more you stress the body, the more it learns to adapt and the more it returns to more of a normal function.
Yeah. That's
Okay.
super cool.
So it's really a tool for people who have concerns, people who get into moderate or mild dementia. We certainly can help mild. Moderate's a little more difficult. We can talk about what we do for those things, but it's just a great tool to give us an early indication of your relative risk as an individual.
Yeah. And so if like there's a 25 or 30-year-old and they detect it early,
Sure.
could it be prevented or could it be reversible?
From everything we know, it can be prevented.
Okay.
Now, what I'm going to talk to you about with that is not necessarily completely prevented, but certainly we can, by instigating the changes in that arena, we can actually make the quality of life and the longevity of your life better. Okay? Nobody wants to be a burden to their family. Okay? It's one of my biggest concerns at 62 just because I have a family history. And so the important thing to understand is that there's not just you're destined to get it, you're going to get it. Okay? Don't ever think like that, because that's just not what the literature is telling us. So basically the categories that we go through in this test is we have the relative risk, genes that are associated with some type of dementia, and you've got the risk, and we got to do something about it if you're in moderate or high. Okay? We have metabolic risk, which means there are certain things that are missing. Zinc's very important. Vitamin D is very important. And so the way we could overcome that is just by supplementing something that is very, deficient. The third actually has to do with metabolic health from the perspective of insulin resistance. It turns out that probably the most significant thing as we age is the health of our batteries, the health of our mitochondria. And so I know everybody has kind of watched people age, and it's like once they get to, let's say, 70, it's like they look the same, and then something happens, it's like they fall off a cliff, and they're gone soon, okay? What that is finally the battery's actually giving out.
Oh, wow.
So things like understanding how you handle oxidative stress in the mitochondria. The mitochondria creates lots of we call them oxidative free radicals or oxygen-free radicals, and that's what antioxidants treat.
Yeah.
So when you're looking at things like curcumin, you're looking at resveratrol, you're looking at the other flavonoids, you're looking at lots of things in our nutritional from a supplementation or from our diet can be added to the body to actually impact that so it doesn't create such a problem. And remember, if my remote's got a weak battery, it might work once, but it doesn't work the next time I use it, and that's irritating. Well, imagine if your battery's weak in your cell and it's trying to execute something and it only gets halfway done, and that's a misfolded protein, and the body's just going to say, well, I better start. I'm going to leave that halfway done protein in the cell, and I'm going to go start over. It's just so commonsensical when you think about it. And it's just devastating. It's devastating to the individual. It's really devastating to the family. And I think that's what everybody worries about is the family devastation.
Yeah.
A lot of people aren't scared. Like, I have Jesus. I'm not scared of dying, but I am scared about being a burden to my family.
Yeah.
Okay.
All right. Well, I know we don't want to dive too deep into treatment of it, but I do want to ask, what are some different kind of in the phases of it? If somebody's high risk, but it's pre any symptoms or anything, what are some things that they can do? And then I'd like to walk through some.
So that's the thing. We know there are things they can do. We just don't know which one's important in you. Do you understand?
So that's the importance.
Because it's very individualized.
Yeah.
Just like genes are. We all look different. God made us all different. And so we need to know which ones are important for you.
Yeah.
Now, supplementation is certainly big. Okay, so you're going to see in every section there are certain nutritional supplements that can be highly beneficial. Now, whether you want to choose to do that in a supplement form or whether you want to choose to do it with a whole food and a diet. So a lot of the information is on dietary changes we would recommend.
Yeah.
A lot of the information is on supplements you may consider. We know that the brain is really funny. The more you use it, the healthier you are.
Yeah.
Okay? And so we actually know in people who become sedentary and old, I mean, your grandmother's one of them, okay? They tend to become less social. They tend to not have a lot of friends and discussions.
Yeah.
They tend to not take on new things. They just stay in the house all the time. That's probably the worst thing you could do, okay? So we do know that some form of activity, whether it's even just taking a walk, is certainly beneficial. And I'll tell you, if you're going to take a walk, it's not a 10-minute walk.
Yeah.
It needs to be somewhere around 26 minutes plus, okay? So I have people that come to see me, they're elderly people, and they're like, I ride the bike 10 minutes every day. And I'm like, well, 10 minutes is not enough. Amp it up. And it's only because you've got to stress the cell enough for the cell to say, okay, I can't keep up. I need to change some things.
Okay.
Do you understand?
Yeah, that's cool.
From an insulin resistance standpoint, a lot of that has to do with your diet. If you're putting carbohydrates and sugars in your system, and the funny thing about it is when your mitochondria get weak, they think instantaneously it's not enough glucose. So you will start craving sweets and carbohydrates like crazy. And the problem is the more you feed that, the worse it tends to get. Obviously, eating a balanced diet. So there's lots of nutritional guides here. We even encourage people, if they have high enough risk, to go visit with a nutritionist.
Yeah.
In fact, on the staff of this company, we have a lot of high-level masters, certified nutritionists that can go through these things and help you design a diet that's very specific for your need.
Wow, that's
okay.
awesome.
We also know taking on new activities for the brain.
Yes.
A busy brain is a happy brain.
Okay.
Okay. You got to be learning new things. You can't just live in your world. And so the reason I mentioned playing an instrument, writing a book, you know, in fact, I ran into my pastor the other day. He's writing a new book.
Yeah.
Okay. And I was like, that's great because that's going to be great for your brain.
Yeah.
Or learning a new foreign language or something like that. So being socially interactive, they also recommend, I saw a rule the other day, some psychologist came up with it, was the 5-3-1 rule. And so essentially you want to have make 5 new relationships or you want to make 5 new acquaintances every month. You want to have 3 new social engagements every month, and then you want to have 1 new friend that you make every month. And so that new understanding, listening to people, learning about them, and all that type of stuff creates neuroplasticity. And I might, forgive me if I misrepresented the 5-3-1 rule, but you have to go look it up and read that article. And then lastly, we also have some mechanisms now, a new FDA test that's actually, it's called a p-tau amyloid ratio. The p-tau amyloid ratio was actually created for people who already have Alzheimer's.
Okay.
So they found out if p-tau was more elevated to amyloid ratios, that you were already starting to get some of the symptoms of Alzheimer's in particular. What we're going to actually do is use that ratio to look at people that are starting to get too high, because we now have the ability in a lot of people to actually wash that protein out, which means that we essentially can do plasmapheresis or therapeutic plasma exchange, remove that poor phosphorylated tau, and bring that ratio down. Now, I want to study it from that type of standpoint because there is a study called the AMBAR study. It was kind of a landmark study where they took people with mild dementia and moderate dementia, and they didn't really quantify it by any biomarker, which I don't necessarily agree with because I like to know what I'm doing.
Yeah.
But what they did is they did therapeutic plasma exchange in those people one time a week for 6 weeks in a row, okay? Now, I think maybe they overdid it. I don't think you need to wash them that many times. But all they did was say, okay, you've got mild dementia, you've got moderate Alzheimer's, mild Alzheimer's, moderate Alzheimer's. And then they followed them for a year. They found out the people who washed their blood 6 times, one time every week, after 1 year that had mild dementia were 30% better.
Wow.
They found out people who already had moderate dementia still declined, but they declined 70% less than the people who didn't get washed. So they controlled it with a group who didn't go through that. And so that showed us that there's something in there that is essentially could be removed and actually help us not get into so much trouble.
Yeah.
Now, you're measuring a blood test for something that's going on in the cells of the brain. So when you wash the blood, it does take some time for those proteins, because we're not washing the spinal fluid, we're not washing the fluid around the brain. So it does take some time for those proteins to kind of move out of the nervous system. But it is something that's very interesting to us, and we would love to have something like the new FDA-approved test to give us an idea of how effective we are at reducing that protein.
Yeah, that's super cool. And I do want to mention that if you're a listener and you hear the therapeutic plasmapheresis, you're like, well, what is that? We did do an episode on it, and so we encourage you to go and check that out and then come back and watch the rest of this episode.
Right. And so in one section, in particular, the section of risk, where we just know these genes are at risk, we think that maybe even washing your plasma one time a year might actually prevent the problem. So it's not like the biggest problem with therapeutic plasma exchange is it's not cheap.
Yeah.
And the expense is not really the process, it's what you put back into the body. So we're spinning your blood and separating it into the blood cells, what we call the buffy layer, and then the plasma, which contains all those proteins, and we're sucking that off. And we take about 60% off with every treatment. And then we put brand new, what we do is 5% albumin. So it's this ultra clear, beautiful new partial plasma. It's not doesn't have everything in it, just has albumin in it. But actually taking out those proteins seems to be very beneficial. Now, we haven't got our hands around it perfectly, so I'm not going to guarantee that it works. But certainly if I had a high risk in those particular genes, not for every section, but especially for that high risk group, the 17 genes we know, this is a problem. That would be something that you may consider.
Yeah, that's super cool.
Okay. So ultimately, feeding the brain appropriate nutrition, keeping its energy up so it can do its job perfectly.
Yeah.
And then making sure that we don't accumulate proteins that are abnormal in some way or have been changed.
Yeah.
We also know that many of these things that we do actually changes the methylation of DNA. So we can also measure what's called epigenetics. We can measure how many, the way that we choose what DNA to read and what DNA not to read is by attaching a methyl group to the DNA.
Yeah.
And the more methyl groups we stick on the DNA, we know that this DNA is essentially turned off to a certain degree, or your cells are in kind of a protection mode.
Yeah.
So we know that if we actually provide better nutrition, better batteries, these methyltransferases, which remove methylation and put it onto the DNA, will actually open up a lot more genes and actually reverse the age of your genes. So we look at the methylation of DNA and we give you a relative age of your DNA versus your stated age.
Wow.
And everybody loves to see that they're younger than what they are. And so there are ways for us to follow it diagnostically, meaning that we have a marker, a biomarker, or some test that gives us indication that we're doing something effective. And so it's something that's going to come along, but we had to have the base tool.
Yeah.
The base tool to actually start to deal with it.
Yeah.
So I'm very hopeful. You know, I happen to have a feeling that God built into us an ability to recover everything.
Yeah.
If we could just learn to activate it or to prevent that from being set off. But cells, it makes sense for the cells to work harder because somebody who basically their brain starts resting, they would probably be eaten if they were in the woods or something's going to happen.
Yeah.
So it's something that's very important to me. This is going to be, it's already a huge problem. It's just going to get bigger as the population ages.
Yeah. No, I'm excited to see, like, over the next 10 years, over the course of time, how it's going to blow up.
Well, if you have an issue, if you want to know about it, go to Extending Me, extendingme.com, and just look at the test. It'll give you some information on it. It has to be ordered by a provider.
I was going to ask.
So it can be ordered by anybody who's a professional, okay? And so you may want to mention it to your professional, whether it's a nutritionist, whether it's your naturopath, your physician, or whoever. We also will have certain medications that we use. Yeah. And so this is also designed for neurologists to have the ability to recognize things early and to get you the appropriate medications that may actually benefit you in that thing. We know that slowing the cell down when its speedometer starts to really ramp up, we have things that are longevity methods that can actually slow the cell down so it doesn't tend to overload itself. Yeah. So mostly dementia is something very simple. The cell is working so hard that it's just using everything it has, and when it runs out, we're in big trouble. And that makes sense. I use silly analogies for kids, and I'm like, okay, I've got a nice truck outside, but if I forget to put gas in it, what happens? And they say run out of gas, and I say, does it run out of gas in a good place or a bad place? And the answer is a bad place. So I usually tell the kids, the reason your parents the reason you're here is because your parents love you and don't want you to run out of gas in a bad place. So they're going to give you vitamins and some medicines to take to make sure that you always succeed. And it seems to work.
Yeah. I do want to ask real quick.
Sure.
What are some different kind of treatments or things that you do for people that are in like the severe stages of dementia? Is there any way to make them comfortable, or like from your standpoint as a provider, like have you seen anything?
I can tell you that there has been some effort, because we've made some, and I know other people are making efforts in using things like stem cells, exosomes, to try to reverse the process. It seems that exosomes are basically chemical messengers that come from stem cell derivatives, and they're very effective at shutting off inflammation. So when you get them, the first thing that actually happens, they have these special RNAs in them called microRNA, and microRNA tends to turn off inflammation. So any brain that's inflamed is in trouble. Yeah. So turning off inflammation, that can give us a fairly acute effect. The second is messenger RNA, where we can actually deliver these brand new packets of information so you can produce more appropriate cells has worked to a certain degree. And we're not really sure if it's the messenger RNA or just turning off the inflammation that gives them the benefit. And then we have tumor suppressors in those exosomes too, so they actually can help with not growing tumors. But the long and the short of it is, once you've gotten into that moderate phase, you're in pretty big trouble because the cell is just so far gone. Yeah. And so those are the only things that I've seen that can actually benefit us. And it's really, unfortunately, it's about expense. Yeah. I mean, exosomes, you have to be reasonably well off to get them. Yeah. I can tell you we're very inexpensive at my office. We charge $2,400 for an IV treatment of those. And I can tell you that, we wished we could charge it. I mean, if they were cheap, I'd give them to everybody. Yeah. But in general, that's the only thing I really know. Now, nutritionally helping them, getting the person busy, getting them out of their house is a job. Yeah. Okay. Yeah. Because they get really comfortable, especially if they lose a spouse or something like that. It becomes
really hard.
They love to just hibernate, and I don't quite understand it. So we really need to get the word out that that's the worst thing that can happen to them. And, and I know there's depression involved and mood abnormalities involved and lifestyle changes. I mean, many women in particular live for their families. Yeah. And so once if they don't have a lot of grandkids stimulating them, or their spouse is not there, even if their spouse was irritating as he could be, once he's not there, you just have a loss and you don't know what to do with yourself. Yeah. And so I think a lot of it's more genetic understanding of the potential, but also educating people on you need to be something for society.
Yeah.
You need to have a reason.
Yeah.
Even if it's going out and working on a community garden or going with your friends to do something, you got to stay social. We know that that's a really big player in this environment.
Yes.
And you just gotta have, as a family member, you got to encourage them to do that and invite them to everything. And sometimes you have to physically go get them and get them out of the house. So the more you can keep your brain working, the more it adapts to being stronger.
Yes.
Just like if you don't use your muscles and exercise, your muscles will deteriorate. And so we really got to just get education out there of what a normal aging process should be. Because unfortunately, the family group now is so fragmented where it used to live together. Mm-hmm. And so, when families lived together, they would involve the older individuals in everything they did. And they still have a lot of cultures that do that. Yeah. Those are the cultures that live till 100 years old a lot. Yeah. And so it's nothing new. I'll tell you a really interesting thing that I learned. I was watching a National Geographic special on blue zones, okay? Really interesting. So one of them was in Sardinia, which is the big island kind of off of Italy. Yeah. And so they went there to kind of study. There was lots and lots of people that lived beyond 100 there. And they looked at their diet, and of course they ate pasta and garden vegetables and everything, but their pasta was locally grown and all that type of stuff. They really couldn't find a correlation with diet because they all kind of ate the same thing. Finally, they brought a statistician in, and that statistician somehow noticed that the steeper the village was, the more 100-year-olds they had in the village. Wow. So it was and these people don't drive cars. They get out and they walk to see their neighbors. They walk to the market. And it turned out the more that person had to go up and down hills and the more activity they had, the higher their longevity was. So that's why you need to get out and do some exercise, not ride your bike for 10 minutes. And I hope she doesn't get mad at me if she listens to this, but she'll know who I'm talking about. Okay? Because she's like, I hate exercise. I hate it, And it's not exercise for the sake of exercise. It's exercise for longevity and well-being.
Yeah. Yeah. That's awesome.
I hope she doesn't get mad at me.
Well, alrighty. Is there anything else you want to add?
I don't really think so. I think that, utilize the test. We're going to learn more. The nice thing is we already got your genes. Yep. So the other thing about extending me, they won't be selling your genes, so don't worry about that. Yeah. Okay? Because I have a decent say in the company. I'm obviously not the major guy, but, I'm opposed to that kind of stuff.
Yeah.
Okay?
No, that's awesome.
Extendingme.com.
Awesome.
Okay.
Well, alrighty, y'all. We would like to thank y'all for joining us for another episode of Coffee with Dr. Stewart. Make sure you like and subscribe to this channel, and then also follow us on all of our social medias, because that's how you're going to stay in the loop with everything Coffee with Dr. Stewart. So again, thank y'all for joining us, and be blessed.
This show is for entertainment purposes only. Please do not use anything mentioned in this show as your own medical advice. Please discuss all medical issues with your own provider.